Let me pull in Dr. Nagarajan Venkataraman here. Dr. Venkataraman, a couple of questions. One, why is it that the populations in Pakistan and Bangladesh have proven to be more resilient to this virus than the population in India? And I ask this question because I'm assuming as a layperson that this area people more or less have the same genetic disposition. And secondly, despite a very strict lockdown, why is it that the cases have been on the rise?
It's a very good million-dollar question, but very difficult to answer. That's the only issue. That is, most of them have a genetic composition more or less similar, but not exactly, I would say. There are certain minor differences between the community of Pakistan and Bangladesh, and little variations are there because most of the pandemic don't affect Indians, and they do affect Pakistan and Lahore as well as the Bangladesh. So there may be a small one issue is the genetic composition. Apart from genetic composition, there is an inherent immunity developed in them. Probably I could imagine that because there are no definite proof for anything, probably one could imagine that they have a herd immunity, inherent immunity in them, and the immunity protects them to a certain level, and also that Indians are not exposed to that amount of immunity. And second issue is, as far as the pollution is concerned, the lung capacity and as well as the lung receptors are supposed to be more involved in to be resilient to the coronavirus. That may be the little issue affecting India. And third issue is, I could say the public unawareness. Even though the government